On Tuesday, April 26th, McDonough District Hospital, McDonough County ESDA, Western Illinois University, and other county agencies all came together for a mass casualty training event. We're going to take you behind the scenes to see what all takes place during our training to prepare for such an event.
Today's exercise went really well. We had an exercise based on the patient search. So we had a scenario of a possible burning incident on campus here in WIU. We received an outstanding number of patients. In this case was 34. From those patients we were able to transfer some. 10 someone here at the location, and admit someone here at the hospital. So the whole point of this exercise is to overwhelm our capacity and see how we'll react when we have something out of the ordinary.
You know, I think anytime we put an exercise sort of in play, we see a lot of things that we thought we knew that we needed to have further discussion and provide more context and detail to. That's what we saw from the university side was, we know in an event that it's going to be imperative that the community and campus are going to have to come together to help successfully navigate that. And it was nice to be able to sit down and bring all the entities together and walk through those things. And again, it's not necessarily about the totality or the big event that we're speaking about, it's the details and getting lost in those and working through those things. So that's probably what I saw as the most important part, was just working through the details, understanding who the players are. At the university level, we see a lot of new faces, a lot of new names that come annually, and just getting them plugged into that model and understanding that collectively it's going to take all of us to rectify the situation.
I thought it went extremely well. Our collaboration with community entities such as the police department, health department were absolutely phenomenal. We had entities that are contracted out through the hospital that showed up and participated and gave great advice on improvements, and it's always a great opportunity to learn and grow. And I think we've all proven that MDH is prepared, and you know, while there's always improvements to be made, we will succeed if a disaster comes.
Well, from today's exercise we were able to coordinate. Coordination is one of the things, and communication is another thing that we always test in exercise. We did really well communicating here. We not only internally here in the hospital, we also members of the community. And our coordination, we use an incident management system, and we were able to allocate resources and coordinate with external agencies in our response. We developed this friendship during COVID response. We were able to, we know exactly who to look for. We know our members of the community. We're a small community, so we work well together. And that's something that we developed during COVID. Any event like this can happen, and the fact that we tested out and we're able to see our weaknesses now when it's a blue sky event, when the actual event happens, we will be ready at a moment's notice.
You know, I think sometimes in any scenario, in any industry, that's training is always important, and sometimes it falls to the bottom of the priorities when it really needs to be at the top. And you know, with the help of McDonough District Hospital's individuals that are in charge of safety and risks on their campus, they were able to, you know, sort of get us involved and get us part of that process, and we really are thankful for that. There's a lot of new faces, a lot of new names. Those people change all the time. As small and as a community, those individuals change at the community level as well. So it's very important that we bring in everybody from, you know, our police agencies, fire agencies, and hospital to work collectively with the university when in the event something was to happen.
We talked a lot about this during our recap at the end of the event today, and it was literally less than 5 minutes. We had assigned roles and everybody was right into doing the paperwork. We didn't even have to tell anyone what forms to fill out. So COVID has definitely improved our ability to function in our disaster preparedness scenarios.